Thank you for joining me again for another episode on the 11th hour, navigating through end of life. Tonight, we're going to focus on um, speaking about where does hospice take place. Okay, there are several locations where you can receive hospice care, not only in the private setting, but primarily hospice comes to you in your private home to provide the wonderful and compassionate care that hospice is known for. So let's begin tonight's conversation. I hope you're ready. So, majority of people, when they come on service with hospice care, we do typically get asked the question, um, where do you provide your care or your services? Do I have to go into a facility? And the answer is no. Hospice comes to you wherever you are, wherever you're comfortable. Majority of the time, the hospice is provided within the home because that is where the person is currently residing in the home setting, where they feel comfortable and they are surrounded by their loved one, their familiar artifacts, photos of the family, bedspreads, you name it, their life is within their private home. So that is where they feel comfortable, and that is where they remain for services from hospice. Now, although an individual is receiving care within the private home setting, there are a couple of things that we want to make sure are in place in order to make sure that the individual is in a healthy environment. You may be within your home and you want to remain within your home to receive hospice care, but the environment is not safe. It's not conducive to you getting a beneficial healthcare services within that environment. Now, when we say the word private home, homes come, an individual's home may come different size, different shapes. And, we're not here to judge, but we have individuals who live within a single family home, within an apartment, a mobile home. You get my drift. And there are some individuals, and as a social worker, I've been through many different environments. There are some environments that are simply not safe and not healthy for that individual. And for that reason, if the home is not a safe environment, there are interventions that hospice can assist with, and that is your social worker can assist with finding resources to see, are there any things that can be put in place to make it livable or safe for the individual to remain within the home. Now, from personal experience, I've had a few individuals, the home was simply not safe. It was not healthy. In one particular recall of a situation, the patient had to be removed from the home and it was quarantined. I say quarantine, I'm sorry, the health department came and basically put a do not trespass, and the city, got involved, the state got involved. So eventually it was demolished because the condition was so poor and it was not a place where anyone should reside, let alone a person who's receiving hospice care near the end of their life to be in such an environment. Now, moving forward, so yes, why we want and we press, we promote the the desire of any patient to remain within their private setting to receive hospice care. Bear in mind, if there are conditions that would prevent the well-being of that patient to remain within the home. We will work with the patient or the family to try and find something that is workable or that's pleasing to everyone within the determining factors. Uh, Moving forward, so apart from the private home setting, we have individuals who receive care from an assisted living. Now, assisted living, if you're not familiar with it, is typically one of your a private home can become an assisted living. A mom and pop home is a term that they commonly use. It's a private single family home that's been converted to a small ALF. And typically those small assisted living facilities, ALF, may have 4 to 5 patients residing within the home, actually 3 or more. Different states may have different licensing for those assisted living, but in the areas where I have served, if it's 2, you really don't need a license. But if you're providing care for anyone for more than 3 individuals within your home, then you definitely need to have a license, and that is in the state of Florida. So 3 or more. And even when I say more, there is a maximum of individuals that you're allowed to have within the home unless you build a bigger uh, facility. And we do have our larger ALFs, which is still an assisted living facility, which may have countless, may 10, 15, 20, 100 patients, 100 beds to provide care for individuals who are still able to do most of their day-to-day activities, but simply need assistance where you have the word assisted living facility. Okay, there are different types of assisted facilities with different licensures, but overall, the assisted living facility is there for individuals who are still able to perform some of their activities of daily living, but needs additional assistance, especially when it comes to medication, bathing, those sort of things, meal preparation. So hospice would come to you and provide care where regardless where the assisted living is located within their jurisdiction, of course. They do have assisted living facilities, do have CNAs who would provide CNA support, as well as someone preparing their meals, home health aides. Hospice brings on their own sets of professionals, and we do go into the assisted living with our CNAs to assist or to supplement. They can choose not to receive the hospice CNA support if they feel the CNA that they have is sufficient to provide that care. But bear in mind what I said. All CNAs are incredible. They have the credentials to provide the care, but the hospice CNA has additional skills and learning to provide specialized care for a hospice patient. So keep that in mind. So at this point where we are going into the assisted living to provide the care, that is still the resident's personal or private residence because that's where they reside. And we show the same level of respect to that individual, regardless whether it's a private home setting or assisted living facility. We go in there knowing that is your private home. We respect it at that level. And so we go to meet the need of the patient wherever they are. So apart from the assisted living, we have the nursing home facility. Now, a nursing home is similar to a hospital, but at a nursing home, that is your residence, especially for our hospice patients. You're there, that's your residence. You're not moving unless your family decides to move you, but that is your home, that is your setting. So you're at a nursing home, and nursing homes are 24/7, and they have RNs, they have LPNs, they have CNAs, they have administrators. Some nursing facilities, I want to say all of them, but I don't want to misquote, but I believe they're required to have a social service on board to assist with social service needs. But even then, the hospice team comes in to provide care with the full team. So you still receive your routine nurse, you still have your social worker, you still have chaplain service, spiritual support, you still have CNA support, and also volunteer support if there is a need for it. So with all these services from hospice follows you no matter which setting you are on, so, you are located at. So tonight we're simply focusing on the different settings where you can receive hospice care. There is no there's no place that hospice does not go into, as far as I know. Um, we come to the patient where they are located. So we're talking at this point about the nursing home facility. And within the nursing home facilities, you also have CNA support. But again, we provide CNA support from hospice care. We coordinate with the CNA that are located at the nursing home or assisted living facilities to see which schedule fits the patient, as well as the nursing care. The social work, now that's different. Within the nursing home facility, um, the social service has a heavy caseload. So you may not get routine visits from the established social service within the nursing facility, but your hospice social worker certainly would make a schedule and a time to come and provide care and to be there for emotional support and to discuss the things that are stressors or that are complicating your mind, that are find relief, find emotional relief, find someone who can provide counseling for you at the end of life. So your social workers are there. In terms of spiritual support, some nursing facilities may have a spiritual coordinator who visits patients in there, and they would be more than happy to add your name on the list if you so desire. Hospice comes with its personal spiritual support um, person or personnel that can schedule time to come in based on the patient's need. Right? The next um, facility, the hospital. We have patients who are within the hospital who've been diagnosed where it's a very progressive um, terminal illness that may not be reasonable for the person to exit the hospital but remain within the hospital, and therefore hospice is there in the hospital to begin with anyway. So then we would place that patient on hospice care within the hospital setting to provide and make sure that they receive end of life treatment and care. The hospital I won't dwell too much on. I simply want you to know, even within the hospital setting, there is hospice services available, and you would receive a nursing visit. A social worker would come out and visit with you, as well as the chaplain. The CNA, now the hospitals do have that CNA care. We would provide CNA support if there was a need for it, but typically the hospitals have enough or have a good staff of CNAs to come in and provide the CNA services required. If they're shorthand, certainly our CNAs are on ready to go into the hospital and provide care for our patients who are in the hospital setting. Another setting that we have, and families typically refer to it as the hospice house. It is a freestanding hospice facility. or you may hear the term in-house hospice care or general inpatient care. Okay, so that is a facility belonging to hospice and made specifically for that hospice patient to come in to receive usually general interventions. Maybe there's a situation of symptom management. They go in for symptom management majority of the time when the symptoms cannot be manageable within the home setting. Then we transfer that patient, or even the hospitals or assisted living. We would transfer that patient into our inpatient unit to receive symptom management. It is primarily reserved for symptom management. I typically get a lot of family who say, "Oh, what about your hospice house? When can I go in?" Here's the answer to that question. The hospice house or inpatient unit is reserved when the patient's symptoms become unmanageable within the home setting. Even in the hospital, we may transfer that patient to our unit or from the assisted living to the unit because we want to manage that per individual symptoms around the clock through specialized hospice care. All right, so that is the purpose of the inpatient unit. It is reserved for symptom management. Not only, but primarily, that is the purpose of it, is to manage those pain that cannot simply, no matter what interventions are put in place within the private home setting or the facilities, the pain is still not under, it's not well managed. We transfer that patient to our inpatient unit for it to be managed by our physician and our care staff. The other reason why, excuse me, before I move on, so you have pain, which may require additional management skill. You have breathing complications for our COPDers. They may have severe complications that for some reason it's not, the interventions that are being put in place is not sufficient, cannot meet the patient's need. We'll transfer them into our inpatient unit. We have terminal restlessness is another major one, and the reason why we would transfer a patient to the inpatient unit where the patient becomes very restless to the point where they're climbing over the bed or they can't stay still. The treatments are being provided by the family or by a specialized individual within the facility, but it's still not manageable. It is simply not, they are simply unable to get under managed. It's beyond what they're able to provide within that facility or place. At that point, we would transfer the patient to our inpatient unit to receive around the clock hospice care, hospice focused care to manage those symptoms. So what did we talk about tonight? We talked about the different settings that we as hospice providers can go into to provide care for you. So we have the private home setting, which majority of our patients reside within the home. Okay, we have the assisted living facilities, we have the nursing home facilities, we have hospitals, and we have our general inpatient unit where we can bring our patients into to provide care, around the clock care for that patient within our inpatient unit. That unit is reserved for symptom management. So remember, I said those words. It's reserved primarily for symptom management, but we go where the patient's located. Okay, even a hotel room. In Florida, we've had hurricanes where the patient cannot reside within the home and they relocate to a hotel room. We follow the patient. We go there. We have patients who go into shelters. We go into that shelter to provide care. So it's not just limited to, how many did I say? We have the private home setting, the assisted living, the nursing home. We have the hospice and general inpatient unit. We have hospitals. So I named 5 main typical places that hospice go into, but it's not limited to just those 5 places. All right. I hope you enjoyed tonight's segment in regards to the places where hospice will provide care and services. Thank you, and see you again on our next episode.